Awesome. Thank you. Hi, everyone. Welcome to the final session of the 2023 Culture of Data Conference, and thank you so much for joining us. My name is Allison Rosenthal. I use she, her pronouns, and I will be moderating this session today. We also have Peggy Jarrett, who uses she, her pronouns, who is managing the Zoom and making sure the tech is all running smoothly. You are all muted now, but if you have any questions during the Q&As, if you have any questions or comments, please use the chat or you can unmute yourself. If you are comfortable doing so, please add your pronouns to your Zoom name by clicking the 3 dots on the video square and selecting rename. And I am also wearing 2 hats here today at this session. I am also the representative for the sponsor organization. I work for the Office of Research and Statistics, and my office is proud to sponsor this Culture of Data breakout session. Our office is part of the Colorado Department of Public Safety, and we provide decision makers and the public at large with data on criminal justice in Colorado. We believe that our data could be used to help break down silos between public health and public safety, and we welcome you to go to our website, ors.colorado.gov, and take a look at our published reports and dashboards featuring original data sources and secondary research. Here are just a few of the many topics on which the Office of Research and Statistics provides data: criminal justice contacts with students, impaired driving, the impacts of marijuana legalization, and racial disparities in criminal justice decision points. We are also in the beginning stages of collecting data on all law enforcement contacts with civilians, which will be a key data source to facilitate increased transparency in law enforcement operations. This first report based on the new data source will be released this year. The Office of Research and Statistics also staffs the Colorado Commission on Criminal and Juvenile Justice, whose mission is to enhance public safety and justice through evidence-based analysis, resulting in legislative and policy recommendations. Commission meetings are open to the public, and we welcome your interest in criminal justice reform in Colorado. Go to our website, ccjj.colorado.gov, to find out more information. Excellent. In today's session, we have 2 presentations today. Each will be about 20 minutes in length with a 10-minute Q&A portion afterwards. We'll also have a 5-minute break between the presentations so you can stretch and get some more coffee if you need it. The theme of today's session is exploring new data sources to break down information silos, and we have 2 great presentations on this topic, and they will show us different methods to use and also new data sources. Our first presentation is More Than One and Done: Ecosystem Data Tracking and Learning. And this will be presented by Dr. Danielle Varda. So Danielle, please feel free to take it away.
Okay. Let me go ahead and share. I'm just so pleased to be here today and grateful for time together. I'm a big data geek, like I think a lot of folks on the call, and have been using data to help build capacity in communities, especially around local public health systems, but also health systems in general for about 15 years. And the talk today is a little bit of a reflection on how that has changed over the years. So my name is Danielle Varda. I am an associate professor at the School of Public Affairs at the University of Colorado, Denver, but I'm also the CEO and founder of a company called Visible Network Labs. And Visible Network Labs is a organization that is really the place where we house all of our work around measuring collaboration and networks, ecosystems. And we brought that work out of the university in partnership with the university to have an entity that's a social enterprise. So that's the work that from which the lens I'll be presenting today. And our goal is to really make invisible networks visible. I don't think it's new news to anyone out there, but we're all embedded in these networks all around us, but they're really invisible and they're hard to see, they're hard to measure, they're hard to capture and understand if we build them in better ways, whether they're going to help improve health, mental health, and wellness outcomes. So our goal is to make those visible because we've seen the power, the strength of what happens when we can actually see these things, and they're hard to measure. So, if we can really dig in and try to understand how to measure hard to measure things, then we're really excited. So I'm excited today to share a little bit about how we're doing that and how it's kind of changed over time. I thought I would bring these back in. It was just part of what I prepared when we were applying, submitting the abstract for this, but I will go through a little bit of network theory and look at what kind of the tradition has been around using a network science approach to look at partnerships and collaboration, primarily as one-time evaluations, but why, and talk a little bit more about why that methodology is not actually as relevant today as it was when I started doing this work about 15 years ago, and just talk to you a little bit about how we're working with communities to use more of an ecosystem tracking over time and learning approach to this work. So I'll just go through a few of those things. I do use network science as a unique lens, and I'll only talk about that briefly. I mentioned I'm a professor, so I can sound a little professory at times, but I try to bring it right back to practice as soon as possible. But network science is the science of how things are connected. It's pretty simple, and because we're human beings, we're doing network science every day. Just the interaction of trying to understand all of our relationships, even in this session, just, me wondering, how do people perceive me, and wondering, how I'm connected to those on the call. It's network science happening. So as humans, it's a science that we implement every day, but it's one that's not as familiar in the way that we think about like how to do our work and how to think about data. So just a couple of things on that. The real new norm is this, what we call the network way of working. So the idea that we're working across boundaries, building partnerships, it's being legislated, funders are funding it, it's coming into almost every practice that we do these days. And yet we are all still not network scientists necessarily, or data scientists that know how to use an evidence base to do this work. So most of us are doing the work of network way of working using like our gut instinct, our just human hope that we're going to be able to work with large amounts of diverse people and organizations and reach the outcomes that we hope better than if we had done it alone. So my hope is that we can bring a data approach to this so that we can make those more evidence-based decisions to tell the story of our networks, link our work to outcomes, and probably most importantly, take a quality improvement approach where we can use the information to build stronger and more sustainable networks. And something that I've really observed over the last couple of years, I've been a network scientist since I was doing my dissertation work, long before that, I think, because as I mentioned, I'm human. So lots of us have been thinking about this, but something happened over the last few years during the COVID kind of years. Besides the tragedy that COVID was, there was some things that have come out of this that have, I think, helped strengthen our system's approach to thinking about things. COVID essentially made us all network scientists overnight. I just remember the messaging real quickly: stay home, but build a strategy. Think about who you're going to connect to. What's the cost and benefits of those connections? What should I develop? A very open network or closed? What's the risk of expanding my network, and what's the rewards? And these maps that I'm showing on the screen are things people started seeing every day and started understanding like what it meant to look at a map like this and start to understand the implications of, who's connected to whom. So for me, in the work that I do, there was this kind of thing that happened over the last few years where people really got it. People really understood this systems approach, a network science approach to thinking about this stuff, because they were doing it themselves. And it's actually made it easier to do this work. But on the other side, people now know there's data like this that you can get to describe relationships and visualize them. So people want more and more of this. So this has been kind of a thing that I think was a positive outcome of COVID, is that we have collectively become systems thinkers in ways that have never happened before. But another consequence of that is how people also kind of think about and understand the dynamic nature of these networks. So I keep saying the word network. So just to level set, What I mean are these nodes and lines. So there's these nodes, which can be organizations, people in a whole ecosystem. They can be all kinds of things, events and places and beliefs. But the line between them are the relationships. So from a data perspective and a data science perspective, what we're trying to do is operationalize these very complex relationships. So when I use the word networks, I literally mean nodes and lines. Because that's how we measure them. So some people call this collective impact, some call it just collaboration or coalitions, lots of different ways we're thinking about this, but in all cases that I'll present going forward and from a data lens, this is how we do this. So the nodes can represent individuals like the actual entity, actor in the network, but then they can all have attributes on top of them, which help us describe the patterns and help us look for reasons why these relationships exist, and also allows us to measure the quality of them and the perceptions that we all have of each other. I always say this, there's no real measure of a relationship except the perceptions that we have of each other. Like my perception of you and your perception of me is our relationship, but it's really hard to see and it's invisible. And so to get data that helps us understand those really complex dynamics gives us a kind of understanding that helps us leverage them better. So I'll just give one example and then of a little bit more in network science, and then I'm going to go into some tools and examples of how to do this in practice. But you'll see this slide, it says life cycle of a sustainable network. I've been studying networks and what makes networks effective for years and years. And what is true more than ever is that people are not sure how to keep them going. I started some work with the Bill and Melinda Gates Foundation, and they came to me and said, we need to figure this kind of stuff out because there are so many networks in so many communities now that we're sure there's some graveyard where networks go to die, but they didn't know how they got there and when they should. So we've been studying a lot about how to keep these things going and when we should not. So just real quick, if you look in the center here, you'll see these squares and circles. So imagine these are organizations in your community. In every picture around here, they are in the same spot. So the only thing that's different are the lines between them. So what we've seen happen in hundreds of communities over time is a network approach gets started and some entity says, let's do this, maybe a cancer coalition. We bring people together who we know are kind of usual suspects. But the very first thing that almost always happens in network building is we list who's not at the table. And then very quickly, probably the next meeting, we invite those people to come and we start building our network. And then here in phase 3 is where I meet almost every community network, which is this growing the network phase, which they're really focused on a more is better approach. But inevitably, a free rider problem kind of starts to happen. There's always an entity that's bearing the weight of all of this. People start to lose interest or maybe not be as committed or engaged. And it gets really hard to sustain this more is better approach. So we've really instituted a lot of thinking around how do we actually create a network that maybe has several priorities, maybe subgroups, and we only invite people to meetings when they're going to do something, they have a role. Maybe there's a couple of folks that meet more frequently, or this group meets weekly, but this one meets quarterly. And maybe we all come together once a year, but because we have spent time over here in phase 3 building trust, and understanding power dynamics, and understanding the value of our relationships and the authenticity of the processes, that we can use all that information and data to build something that requires fewer resources, but has the same collaborative advantage. So what we're really testing is a couple of ideas and theories around ways we can build out networks that leverage all of the work we've done to build them, but think about them in terms of how to invest less time, less asks for people, and really send out a message that we're trying to ask you for less, but leveraging you to have the same collaborative advantage. And what we encourage folks to do is actually think about when this should end. So what's the end of a network? And it's almost like negative to talk about an ending of a network, but truly there's times when we've reached the outcome and we should disband or recalibrate for something else. So all these kinds of things are what we're doing, but we really believe in order to get through this kind of thinking, you need data. Okay, so that's going to lead me to this last part. Oh, one thing I was going to offer, I'll put it in the chat during the next presentation. I like to offer tools for people because I know you're out there doing work at your organizations. I'm going to send you this worksheet, which is a way to kind of start mapping a network in an exercise. So just if you or people you know, you want to start thinking about your world as these nodes and lines, this is a nice worksheet that lets you do it. So I'll share it in a minute. I just like to make sure there's a tool that you leave with. Okay, so just the last part of this, I wanted to talk about this kind of evolution of this work. So I've been doing all this work for a long time. And the primary approach has been using network science with a social network analysis methodology. I've built a platform called Partner, which has been funded by the Robert Wood Johnson Foundation for years. And it's a way that we hope to help communities use this kind of complex science, but in a really tangible way. It was built for the primary purpose of what we call the one and dones. So an evaluation, we do the study, we present a report, and we send it over. What we have found is that over time, people understand that these kinds of data are changing, they're dynamic over time. So the need for more than a one and done to something that's more of ecosystem data tracking and learning is more prevalent than ever. And what do I mean by that? Well, we're really looking at different ways that data come into a system like that. As you can imagine, tracking anything that's changing all the time kind of requires a lot of input. So there's a burden on getting that data in, but some of it exists as secondary data, but a lot of it also needs to come in as primary data. It requires maintaining a dynamic data system that's continuously updating. From a data perspective, I would say probably the biggest challenge to this is timestamping, especially when we're talking about multiple complex relationships. To timestamp that at any point in time is pretty complicated. So that's something that we've been working really closely on to try to nail down. But then in a dynamic system, we want to start comparing. We want to look at benchmarks and how we've changed over time. We want to see how groups change over time, but also how the outcome changes because those changes to our relationships is different over time. And a few things here at the bottom, we don't just need powerful analytics and reporting as insights anymore. We also need smart analytics. So when we have data that comes in and is updating, there's a real opportunity for machine learning and AI and all kinds of different integrations to help us learn from those data and continuously build out better strategies. But we also at Visible Network Labs believe in the democratization of data. So if you're going to collect data from communities, we really encourage you to give it back to the community. So in a system where we're asking people to put in a lot of data, we need to cycle it back out to them so they're building their capacity and learning from it. So we've really taken all this learning and tried to put it into a framework that still lets us do a typical kind of network evaluation, but these kinds of typical questions are kind of static. Like we might just want to know like what sectors are working together, or what are the gaps? And so these are traditional kinds of questions that we've been able to answer with this approach over time. But today we're looking at networks like this. So this is a network that we captured that changed over 50 years, and you can see its growth and change, but we're also interested in comparing the networks of networks within the network. So being able to look at these different kind of sub-networks is also something that people want to see these days. So that allows us to answer questions like, how are the dynamics of the interactions that move over time impacting our outcomes? So this might seem like really out there, but it's actually the way that we are experiencing community growth and connection all the time. It's just very hard to capture. So I'll just end with a couple of things. I mentioned Partner. So this is our platform. We've primarily been based in a public health kind of systems and health systems place, but even the example I will show will be an example of how that's a little different. The approach that I've been talking about uses network analysis, and we look at it from two levels, an individual level and the systems level. Through lots of research I would share in a different presentation, we learned that just studying systems and stuff at the community level doesn't really help us understand how individuals navigate through those systems. So our community partner relationship management system allows health departments and whole communities, we focus primarily on population and community health, track these kinds of relationships like a CRM would let you, but really understanding all of the different ways that the data interact together. But at the individual level, you might just want to know that about a patient or a person who's trying to navigate those systems. So we've also created, using these methodologies and frameworks, ways that you can capture information from people, like, for example, on their social economic needs, and use this kind of technology to put it together into visualizations that let you, for example, in this case, find someone's most pressing need with their least amount of social support. But mapping all of that stuff together into individual and systems has been our kind of ultimate goal. So I'm just going to end with an example. I just kind of wanted to show you kind of some of the tools that folks are using, and there's lots of other tools. Kumu is a mapping tool, and there's just a lot of different kinds of methods now that you can use to capture these kinds of things. Just to end, this is the DC Legal Aid Transformation Network. They came to us and started in time one here with quite a bit of partnerships, but you'll see in time two, after a lot of network building, they've really built up a lot of that work. And you'll see they're interacting now with all kinds of different sectors to really help bring kind of legal aid, legal justice into their community through a cross-sector approach. Something interesting is, like, we've been able to look at things like the intensity of their interactions over time. We really recommend that folks fall very heavily in this middle section of cooperation and coordination. Too much integration is too expensive, too many resources to maintain. Too much just awareness means we're not really learning from each other. But we saw this network really move into this space where, even though there's more of them and more interactions, they're at a really good place of balance to maintain and sustain that network. We saw some things by looking at it over time that, even because there's more folks in there, the proportions of what they're doing might be less in time two, but they still fall into the same kind of priority of the work that they're doing. And then finally, it's really important to understand things like the value of each of relationships and trust. So what's really nice here is you can see trust is maintained really high over both time periods, but there's been some real differences in thinking about power dynamics, and a little bit around things like different ways that we value each other in these networks. You can use this kind of data and information to build strategies, like really asking what we call questions to consider, using the data and to both explore the result, but then other data to help build the strategy. And there's a lot in terms of these systems that connect back to our geospatial look at things. Like, so on the right here is a network look at, this is an NEKC project looking at networks and communities around kids, working on building out services for kids in poverty. You can see information sharing from a network perspective, but then looking at it from a geospatial perspective, you kind of see it in a little different way. So these visualizations can really help us start conversations and learning. In this particular case, they were trying to build more strategies around advocacy. So this was a really important slide for us and data point where we were able to kind of look at something comparatively and then again over time. And lastly, there's not everything's a network map. In collaboration, there's often ways we think about, like, how are we all on the same page? You can see here as a data point, a whole group, very diverse, feeling, half of the group saying we're somewhat successful, half somewhat unsuccessful. We always say, if we're not on the same page around what success is, it's really hard to get there. So just looking at agreement on how we think about things in these kinds of dynamic situations has also been a strong data point for us to think through. Okay, so I think my time is up. I always throw way too much in there, but I'm really excited about this. And I do think there are lots of tools for folks these days to capture the data, even though it feels really hard. So I just kind of want to encourage everyone to not be discouraged, be willing to measure hard to measure things. And there's lots of tools out there for folks to use. So happy to answer any questions, but I'm going to end there.
Thank you so much for that presentation. Feel free to enter your questions into the chat, or if you'd like to take yourself off mute, you can ask your questions live to our speaker. While you all are thinking, I just had one question for you. Yeah, I just really loved seeing the application of how this network analysis can be used to look at like organizational function as well as like care coordination. And I think those are very like practical ways to use this. I guess I was wondering on the care coordination conversation, specifically when you are working on projects with communities, if how you handle issues about like privacy concerns, if you're using data from social service providers or other kind of sensitive information, and how you like work those into your services.
Yeah, critical question. The tool that I showed there is called Partner Me, and it's really, we're not usually getting data from a secondary source. It's usually a patient or a client putting their information in as a way to show kind of the gaps and strengths of their social connections so that a provider could use that in their care. We spent a lot of time becoming HIPAA compliant. You just can't be in the space without it. We also, with support from the Community First Foundation, launched the first pilot of this in an integrated pediatric care clinic in February 2020. So we had to very quickly also figure out telehealth approach, how people could use this without necessarily sitting in a waiting room answering questions. So it's just super critical. We've also, I'll just be really honest, it's really challenging to integrate the data into other data systems, even the EHR. So it's a challenge I think everyone is kind of facing, but for the most part, this does, in that approach, we do collect PHI, but we even use security as a system to help monitor that. But it's just a great question, and something that, one thing I'll say is like there's advantages to knowing the labels on all those nodes, and then sometimes you don't want to show them, and you might lose a little bit of the information, but that anonymity is critical when thinking about this stuff.
Very cool. Yeah. Yeah, and I also just like loved hearing your beginning of this presentation, just talking about just how important network analysis was during the COVID-19 pandemic, and it really just was such a great way for us to start thinking about our networks and how we're just so interconnected in our communities. Yeah, I just thank you so much for this topic. It's just so relevant.
I'll just say one thing. We did a lot of projects during COVID. Two things were really clear. Communities already have community networks that they were able to leverage during COVID, and that was showed like never before. But also we learned that a lot of folks had strengthened networks during that time, even during times of isolation. So lots of really interesting data we've collected, especially with the Veterans Affairs Office on some of these topics.
Oh, nice. Yeah, maybe taking a step back, it sounds like you've just been doing network analysis for a really long time. I guess just what are you excited for in terms of how we're going to be able to take this even further in like the next 5 years with like AI, as you mentioned, and other new technologies that are emerging? And kind of talk about the future of network analysis.
Yeah, I think when we kind of realized there was a need for more than the one and done, I was sitting in an office with a foundation program officer, and she pointed over there and she said, see that stack, those are my network evaluations, and I don't really know what to do with them. And that's what kind of got our brains churning around like, well, how do we actually, that's been valuable, but how do we actually turn this into more of a tool, a resource for communities? There's so much of this kind of activity happening, but it's exhausting for all of us in community to keep restarting it every time. So one of the things I'm most excited about that we've been working with a couple of different communities on is this idea of creating some kind of like public resource that is the look on this, the CPRM for the county or for the community, so that when people want to get this kind of work started, they don't start over every time. I think that's a benefit to community, and also through a lens of democratization of data to make these public portals. There's a lot of technology that allows us to do that now that lets people easily access that. And just on the AI front, my team and I were talking a lot about this. My developers use AI now a lot to build out some of the even code base for some of this, but messaging, like writing blogs or helping folks see a network data point and know what to do with it. We're finding that it's an enormous resource to be able to have these AI integrations. All the academics on here, if there are many, are going to hate me when I say this. And I will tell you, I've been at the university for 15 years, but we just took our task of doing a lit review of, like trust in networks, and ask the AI, chatbots to do it and get it done in a few minutes.
Oh my gosh,
You have
wow.
to go through it, of
Right.
course, but it's making our ability to take complex topics and understand them in more everyday words a lot easier. So I think there's a lot of hope for translating complex data into practice in communities by using approaches like that. And it took me a few months actually to agree with that, but I'm actually a big fan now. I think the thing I've seen the most is demystifying the complex topics. There's some ways that I've seen the AI programs be able to do that, and the aha on a community member's face when you're using words they understand it's really what's important. So I'm really excited about the future of where this kind of data can integrate with some of the more ways of using big data and machine learning and automation.
Oh, wow. That is very inspiring. Yeah. I feel like it's so hard to synthesize data and make it accessible. And that's great that there are more tools to do that.
Yeah.
All right. If you all have additional questions that come up during later on, I know sometimes that's my style of learning is coming back to a topic and thinking about something else. Feel free to drop those questions in the chat, and I'm sure Danielle would be more than happy to answer those. And with that, I just wanted to give you all a 5-minute break so that we can refresh and recharge, and we will come back for our second presentation afterwards. So please, everyone, come back at 10:55 for our next presentation. Thank you all. Hi, everyone. It is 10:55, and I just wanted to start the second half of our session today and introduce you to our second presenter, who is Georgia Babatsikos. Their presentation is Comparing Program Data with State Data to Better Deliver Harm Reduction Services. Thank you so much, and please take it away, Georgia.
Thank you. I'm just going to share my screen. Because I can't see the slideshow once it's okay. Hold on. Okay, can you all see that okay?
It's in presentation mode.
Okay.
Or we can see like the presenter mode. I think if you go display settings.
Hang on, it's just gone to my other screen. Let me turn that off.
Okay.
Display settings. Is that better?
Yes.
Okay, great. Thanks everyone. Just start my timer. So I wanted to say thank you for that amazing presentation. That's a lot of research and work, and I really appreciate Danielle, all the work that you put into that. So my name's Georgia. I am the Harm Reduction Program Manager at Boulder County Public Health. I use the pronouns she, her, hers. And I just want to give a shout out to my team, many of whom are here today. Madeline, Kelsey, Andrea, Karina, I'm not sure who's all on there, Eliana. But what you're going to see today is a program that is delivered by an amazing team of people in Boulder County. It's a harm reduction program. I will just wanted to acknowledge the traditional owners in Boulder, where we live and work. And the traditional owners here are the Arapaho, the Ute, and the Cheyenne nations. We will be doing, just looking at our program, what do we do? So we're going to go from quite a big picture of what Danielle is talking about to a really practical way of how this looks in programs, how programs run, how data is being collected, how we use the results in the programs. And then at the end, if there's any questions, I'd be happy to answer those. So just a quick overview of what our program is. It's a harm reduction program, which is basically a non-judgmental substance use harm reduction program that is legally operated through state and local laws to provide safer use materials, including injection supplies, safer smoking and snorting equipment, overdose prevention, education and supplies, HIV and hepatitis C testing and outreach, and community resources, treatment and community resources for participants. The goal of harm reduction programs is to prevent HIV and hepatitis C. So we get some funding through the Colorado Department of Public Health for that. And then we also do overdose prevention. And that's the harm reduction grant as well. It's very similar. All the activities are run together. We also offer wound care and referrals. So that's the goal of a harm reduction program. And just at a very practical level, our offices look like a bit like clinical settings. We offer different lengths and gauges of syringes, cookers, mixers, water, tourniquets, cotton filters, wound care and cleaning supplies, naloxone, which is the overdose prevention, drug, fentanyl test strips so people can test their drugs, and so safer smoking and snorting kits. And we also offer ID cards, which provides people legal protection so that when they do get stopped by law enforcement, they can show them the card, which protects them from charges around drug paraphernalia. So just an overview is the goal of the data that we collect in our program is to really bring together all these different sources of information to effectively run and evaluate a cohesive program. So, and we are continuously improving the program. As my team knows, we're always looking for better ways of doing things. We've expanded the program based on various types of data. And basically, ultimately, the goal of using all of this to improve our program is to provide effective services for people who use drugs. Going back to the goals of preventing HIV, preventing overdose deaths, providing support when people are ready. We never push information on people, but when they're ready, we are there with the resources. So the challenge in a practical program like ours, which is run through Boulder County Public Health, it's the third oldest harm reduction program in the US. And it was started way back before there were actually laws covering it, with a collaboration with local community partners, including law enforcement, consisting of the DA's office and the police. So the challenge is, how do we make and use the data in a manageable way and an ongoing way? So what Danielle was talking about, the one-time thing, we have to continually collect data. The challenge is for community-based organizations, which I have worked with for many, many years around HIV prevention and STI prevention, is when you're busy running a program, when do you have time to do this? And then how do you incorporate that information while providing direct services? How do we stop to do that in the way that's most efficient and effective? And it's an ongoing part of our work. It's also ongoing because our funders require that we report things to them. So often when you're a community-based organization, you might be busy running things, submitting your reports, but to really stop and look at the data and try to use that data in an ongoing way is the challenge of direct service programs like ours. The other goal of having this data is to bring the information about our program, about the effectiveness of the program, out to community partners that we work with so that we can advocate for harm reduction and why our program works, and also just to be useful in the community at large. And I'll give you some very specific examples of this as we go through the data. So I'm just going to talk a little bit about the types of data that we collect currently. And I'm going to go through each of these a little bit so you can see, well, we'll go through each of them a little bit. So we have REDCap, which is a state data system that we feed all of our individual participant interactions into. We have participant surveys that we are getting feedback on how we're doing in our program, ideas for improvements, that we report to our state funders, as well as, of course, try to use it ourselves. We do trainings and we try to use the feedback to improve all of our programming, as well as the training itself. We use things like outreach logs, syringe litter walk logs, and we have a lot more, but I didn't want to kill people with data examples, but there's more, and there's new sources that I'll mention at the end. So first of all, the statewide system, REDCap, when we put our data into the system, we use people's initials. There's no identifying information. We use their initial and year of birth, but that's it. It's a confidential system. And within this system, we can identify things like what drugs people are using, what Narcan reversals have been effective and not effective, the demographics of the people that we're serving. That includes racial, ethnic, housing, employment, insurance, things like that, and behavioral surveys, which ask about what people are using and what they're doing. Of course, with COVID, that was very difficult. So we're sort of just getting back to doing those because we had to deliver services outside of a building. And this particular tool, the tools that we use within the system, are a real opportunity to connect with a client, ask questions that really gets you talking with the client, and begins discussions that are super helpful around client-centered counseling and education. So just some of with our the variables in REDCap, some of the data that we collect are overdose reversals reported, ethnicity, race, employment, housing, income, insurance, referrals for substance use disorder, incarceration in the last 30 days. In the injection practice survey, we ask things like the length of the time they've been in our program, if they're using syringes, if they used a sterile syringe, substances being used, if they've ever been charged with paraphernalia charges, if they've overdosed, if they've seen other people overdose, and if it's been effective. When we do participant surveys, we ask them open-ended questions, and we ask things like, what is working well? What are the challenges in accessing services, suggestions for improvement, and how effective referrals have been. And with our outreach and syringe litter walk logs, they're our sort of internal documents, but we also report those to the state, is, how often we're going out on outreach, what we're distributing, and we also use syringe litter walks, a syringe litter walk log, and that's really important And I'll sort of explain a bit about why that's effective too later. So in terms of using the results, I'm just going to go through just a few examples of how we have taken these results and used them to respond using the data and not letting them sit there in their little silos where they often can sit, and how can we use this information to improve our program. So when we looked at our demographics from 20 to 21, we saw that on the top line are the people in our program, and on the bottom line is the census data. And what we saw is that there, for example, in the Hispanic Latinx population, we were seeing around 11%. In the population, it's around 13%, and we did not have anyone who was bilingual, bicultural in the program at that time. And the other thing that we've looked at is the Native American, Alaskan population in our program. That you can see the number is overrepresented. It's 0.1% of the population, but in our participants, 3.9% identify as Native American. So our response to that has been to hire a bilingual, bicultural staff member in October of 2022 who also is Indigenous. And that has been really vital for our community. When I first started working 2.5 years ago, that's when we really started working on this, but it took a while to get the funding, as we all know. We also have a contract starting this year with a group out of Denver who specialize in Hispanic and Native American harm reduction to help our program develop and implement a really targeted program. And we're very excited about that. We're not reinventing the wheel there. And we've also started translating more material into Spanish, which is vital. Another bit of information from our participants is that around, between 51 and 55% of people live in unstable housing or are unhoused in our program. And so one of the things that we've dramatically increased, particularly in our Longmont office, is to increase basic supplies, food, warming supplies, toiletries and things like that, because we noticed that people really needed them, and it's really increased our engagement at that site to the point where we actually have to have 2 offices going because we're getting quite busy there and people coming in. And I actually ran into a participant this week while I was on vacation, and they said, oh, I'm, not using for the last 2 weeks and I'm in treatment and everything, but I need food and stuff. I said, you can come in and get that without getting supplies. And they were like, can I? So we want people to know that even if they're in treatment, they can come in and get these supplies, and that we're there for them wherever they are in their use. So that has been incredibly helpful. Another thing that we supply there is bus passes, which has been helpful for people. And again, part of our goal with what we're doing is health literacy, is teaching people like what's available in the community, and also teaching our participants about what we offer, which has expanded. Also, we have recently increased our focus on housing support. So we are working with the housing providers to understand the system and how we can make referrals better, having better resources on hand for people, learning how to do warm handoffs, and getting people on the phone for services, which has been very challenging when you have someone sitting in your office and you can't reach anyone, especially during COVID. But even we're sort of out of COVID, and that is a challenge for even us. So if you can imagine participants trying to make those contacts, it's quite frustrating. And getting feedback from participants about housing challenges. Many don't like what's called coordinated entry. So we're trying to create a relationship with housing and to also advocate for participants around housing, which is one of the most important issues. Another type and piece of data, and all of this comes from the REDCap system. So the previous 2 slides and this one come from REDCap. And on this one, what we have seen is that if you skip over the blank ones, but the lifetime risk of overdose, if you look at people who've been in our program less than a year, that second column, so the overdose, the brown column is yes, and in 1 to 4.9 years, that brown column is yes, and then it goes all the way down to 5 to 9 years, the risk of overdose goes down dramatically. And a lot of that is due to the education that we do with people, as well as providing Narcan kits. And we have been able to use this information to argue for the program effectiveness in saving lives. So this helps when we go out to our community partners, supporting and expanding naloxone distribution, saying, you know, this works, you know, getting more money, and it's justifying more funding and supplies, naloxone supplies. This supports expanding fentanyl test strip distribution, and supports expanding training to professionals and community members on harm reduction. So we show this slide, we can show this slide and show that, you know, training and making sure people have naloxone really helps. This is another data source. This is actually not from REDCap, but this is actually from the Colorado Department of Public Health and Environment. This just shows overdoses, and it says deaths by drug poisoning. So most overdoses are not intentional, so they are considered and classed drug poisoning. And in Boulder County residents, we can see that over the years, 2018, 19, 20, and 21, we still have, you know, fentanyl is a problem. But if we look at methamphetamine and heroin, there's still, we can see that methamphetamine is still a drug of choice for people. So the impact of that is, well, we can see that we have increased the distribution of fentanyl test strips, but we've also increased the distribution of smoking supplies. We've acknowledged that methamphetamine is still often the drug of choice, so we just don't talk about fentanyl all the time. We need to be realistic. We also use language about how to manage fentanyl and not avoid it. So there are people that are choosing fentanyl. So we want to make sure that our education language is reflective of understanding what people are choosing to use. We have seen a 50% reduction in the demand for syringes, while we've seen an increase in the smoking supplies, and our state funders get that and understand that. That's where we're heading. And then we've started tracking the pipes, foils, fentanyl test strips, so that we can understand where that shift has been and explain that to funders as well as other community partners. So with training, we ask for feedback on, you know, what training people wanted, and people wanted further training on how to interact with people who use drugs. We also get a lot of positive feedback on our training of how it's dramatically improved people's understanding of harm reduction. So that training feedback evaluation is really, really important. And that's a simple evaluation that we do. And then so in order, our response to this was actually to develop a training that was how to engage with people who use drugs. We've got funding for that. Our training itself has expanded dramatically, and through word of mouth, even though we were supposed to only do 12 trainings a year, we've did 25, sort of 75 trainings in 2 years. And some of our key trainers are in this session, Madeline and Kelsey. And we've also been able to train professionals who are participating in the opioid litigation planning, who were able to then vote for more funding going towards harm reduction, which was fantastic. We also track syringe litter distribution, and we can see over the years how many have gone out, how much syringe litter we're picking up. And this is really helpful because it documents that distributing different sharps containers is helpful, because we see so little syringe litter. And when the public calls us with complaints, we can say, hey, we've been out weekly and this is what we found, and thousands of syringes in piles doesn't exist. So but we do take calls if people call us about piles. We usually get there and there's 1 or 2 at the most. So basically, you know, my summary is that data should be used to improve programs and not just sit there in their little reports that go to the state. And they can be used to support program effectiveness. And when you're working in government, these responses can take time. So don't give up, I would say. And, you know, use the information that you've got, and also work with your government, we work with the REDCap system to improve the data collection to fit what we want, which is, it's a very responsive system. So I'm happy to take questions.
Thank you so much for your presentation, Georgia. I just loved how that presentation paired so well with Danielle's, just in terms of thinking about networks and how we in the community, you in the community, are just using your community networks to provide such great services to Boulder County. So I'll remind you again, if you have any questions, please feel free to write those in the chat or take yourself off mute if you'd like to speak with Georgia directly. And as you all are thinking about questions, I just was wondering if you could talk a little bit more about like the housings, like the findings around the housing services and like what coordinated entry is and like what's the best way that government can provide housing assistance to people who are using harm reduction services.
So coordinated entry is where everybody goes through one source, and if people have had a bad experience there, we need to make sure that people have options. So that coordinated entry isn't the only option. So that is important for people. So giving people choices is important. I think streamlining the system and providing tools that people can navigate easily. And even though we recently met with housing, we still walked away kind of scratching our heads like, can we just have a simple mud map of how the system works? And if as a provider we can't understand it, how on earth can we help people? So I think in that respect, we need to make sure that we're supporting clear messages about how to navigate the system. That's really, again, health literacy. How are we going to support people to make their decisions? So that's how I would say. But housing is one of the approach of housing first is a Boulder County approach. I think that approach is probably implemented in a much more rigorous way in like Northern Europe than it is here. So we still got a ways to go, I would say. And I hope my time was okay. I set my time for 20 minutes and then I saw your little message there.
Oh yeah, that was perfect. Okay. We just wanted to make sure there was time for a question and answer. Yeah, and then I just had a question just about some of the recent changes in the laws around criminalizing fentanyl use, and if you are seeing that have an impact on people who are using harm reduction services.
So we're not doing any formal evaluation on that, and I'm hoping that the state does evaluate that. They're still, I think, engaging with an evaluator to make sure that that happens. But so we haven't heard too many horror stories, but we know that by criminalizing small possession, of fentanyl, that people are going to be afraid to call 911 if somebody overdoses. So we hope that changes. They've actually just been voting to revise the Good Samaritan law so that overrides the possession law, and we advocated for that when it first went in, but we're having to re-advocate for that and explain why that's vital. So the Good Samaritan law would protect someone if they stayed with a person who overdosed, which is critical to saving lives. And that's what we do. We're here to save the lives of your loved ones, anyone's loved ones. So ultimately we advocate for that, less criminalization.
Yeah, for sure.
Did anyone else have a question? Is anyone out there using similar state data for any practical programs that you're operating? It's all quiet.
Yeah. Overall though, I think this is a really great way that you guys are using a variety of data sources to really understand and offer better services.
And I just want to mention there's a new source of data that we're going to be working with called OD mapping, which is overdose mapping, and we'll be able to we're not allowed to sort of put up a map of Boulder because it's actually confidential information between the health department and law enforcement, but it's a nationally recognized best practice. And so what we'll be able to do is see where there are where the overdoses are happening, and then we can go in and, but previously we got information like a year later. It wasn't mapped. It was more, you know, anecdotal from our relationship with the law enforcement. And that is going to make a big difference. And we have a collaboration where we both, public health gets the information, law enforcement, first responders put it in, and that's going to be a bit of a game changer for us to be able to do more street outreach, provide naloxone in public bathrooms and places where we can reach people. So that's going to, it's also a reason for going in, you know, and saying, look at all these overdoses. We haven't had that before. So it is a map that maps it, not, it looks like it's on a street, but the reason we can't publish it is because people would look at it and be like, that's my corner. And it's not, it just, it's sort of, it has to be put somewhere on a map. So those maps are not really for the public, but we will be using those. And that's going to be another source of information. And when we sit and meet with our partners, this is where we can use the data to argue for what we're doing and doing more of it.
Yeah, yeah. I feel like that way that you described, like how you're going to be using the data internally, but not publishing it, really aligns with our keynote that we heard yesterday, just about what is the risk of sharing data and how it may impact people like who use those services. So that was such a great real world example of that.
Yeah, and also I think, you know, with our REDCap data, we fiercely protect the identity of participants in our program. And sometimes it takes a little convincing of people, you know, they come in like, oh, this is a government program.
Yeah.
That, you know, we're there to protect their identity and to, you know, look after them. We're not going to. So that's, you know, the people who come in and have been coming in for a while. But I had someone come in one day and they said, for 2 years, I've sat down there in the lobby, you know, while my friend came in. And then finally I came up. You know, it's kind of hearing things like that we're like, oh, you know, we still want to, you know, make sure that we are letting people know that we're there to support them and protect their privacy as well. So we do everything to, you know, like create privacy for them when they come into the service as well.
Oh, that's so great. And that's such a great story about how you've really like built trust with the people who use these services, and they really do. And that's like a way to engage more people. Awesome. Well, thank you so much for your presentation, Georgia, and to Danielle. This was such a great session. I just wanted to give a couple closing announcements for the conference. Thank you all for attending this session and for participating in the Q&A. We have slides, and I'm going to be posting the handout that Dr. Varda provided us on Sched, so you can access that for later. You will also receive a conference evaluation via email after this conference is over. Please fill that out, even if you only attended a portion of the conference. We just use this information in our planning committee to help make this conference better. And if you fill it out, you can also be entered to win one of 2 $50 gift cards. We do have, although this is the last live session, we do have one final session available in the conference. It's a walk and learn session on equity in career advancement in academic medicine. So please feel free to listen to this walk and learn, take a walk, and enjoy the rest of your day. And if you enjoyed this conference, we also encourage you to check out Public Health in the Rockies. This is CPHA's other signature event, and we are going to be opening up abstracts. So you can submit your presentation proposal there. Go to publichealthintherockies.org to learn more. Also, thank you so much for supporting the Colorado Public Health Association or CPHA and for joining our conference. We hope you had a great couple of days and you were able to learn and connect with other people here. And we just really wanted to thank you for joining us. Thank you.
Thank you.
Thanks.
Thanks, Allison.
Thank you. Thank you so much. That was such a great presentation.